All right, guys, so today we're going to look at poisoning and allergies notes. By now, you guys hopefully already completed this module, or actually it's a little scattered. So a couple of these modules. So let's get started. So what number should you call if you suspect that someone or yourself has been poisoned? So according to our training, there are two numbers you need to call. First, you need to make sure you call 911. And then second, you need to make sure you call 1-800-222-1222. And that is poison control. So what should you do if someone you know swallows a poison? So we're gonna not just cover like ingestion of poison, or we are referring it to as poison, but it doesn't just have to be poison. It could be like any harmful substance, like a chemical or a cleaning product, or so on and so forth. So your training actually goes through what happens if you ingest it, what happens if you inhale it, or what happens if you make contact with it. So those are the three things we're going to look at. So again, going back to what should you do if you ingest it or someone you know ingests it. So first things first, you need to make sure you call 911. And then because they can get an ambulance to you, firefighters, they can get help to you right away, whereas poison control can't do that, but poison control can point you in the right direction of what to do. So you want to call 911 first, and then you call poison control, and I'm just going to shorthand poison control PC. Now, when you call poison control, there's a couple things that they're going to ask. According to your training, right, they said you might need to know what substance was ingested. You might also need to know the age and weight of the victim. You need to know the time of ingestion or exposure. You also need to know the zip code and contact information. So what should you not do if someone swallows poison? Usually, people always want to give their own remedy to someone, right? Like I had a dog once and she ingested rat poison and my dad immediately wanted to give her milk. So a lot of the times our first instinct is to help someone vomit or give them a remedy at home. But that's exactly what you should not do, because in some cases you can actually make it worse and you don't know how the remedy you're giving the patient or the victim can react with what they just ingested. So things you should not do is give home remedies, right? And a lot of these examples would be like salt, eggs, or raw eggs. Sometimes I don't know why people do that. Or like citrus juices. One popular one is activated charcoal. And there's so many others. And then the other thing you don't want to do is you don't want to force them to vomit. Like I said, sometimes this can actually make things worse. So you never want to do anything unless you're instructed by poison control. You might actually call poison control and they might say, do you have milk? Do you have juice? And so then that's when you should move forward. But otherwise, don't do anything without being instructed by poison control. Okay, so if someone has poison or something that gets into the eye, what should you do? Now, a lot of the times, things that happen like you getting a chemical in your eye or getting something on your clothes or inhaling it, this tends to, most of the time it happens at work or in a work setting, right? Where you're exposed to these chemicals, because we usually keep everything safe at home. It's typically like kids who get into things, not so much adults. But if it were to happen and you're in the workplace, right? After you've called 911, and poison control, they will usually instruct you on what to do, right? But meanwhile, or usually what they'll instruct you to do is to make sure you get water or eye wash station. Or use water to wash out your eye. And typically you want to do this for 15 minutes. You just want to let the water run on your eye for about 15 minutes. And this is typical. This is not just for eyes. It could also be like if it gets on your skin. But like I said, typically you won't have an eye wash station at work. It's just very common for these types of incidents to happen at work, which is why I'm bringing it up. But nonetheless, if it gets into your eye or someone else's eye, make sure you wash it out. Please don't try to give eye drops or anything like that, because again, you don't want to do anything unless instructed by poison control or a health professional. Never try to do something you're not sure of. Okay, so what should you do if someone gets poison maybe on the ground, or something is left open or spilled, and then we inhale it, or someone inhales it? How do you deal with this? Well, again, you want to call 911 and poison control, because they can also let you know how to handle or how to deal with the spill. And then you want to make sure that you get people out of there. People or person out into fresh air. You want to make sure that the area is ventilated. Right? So like open windows. Turn on the air, the fans. And make sure you are paying attention to the person. People or person. To their breathing. Because it could be that after inhaling, they're having a hard time breathing, and so you might end up having to give CPR. So what do we do if someone gets stung by a bee? Well, number one, you want to gently scrape out the stinger. And you can do this with your fingernail or a card, as they showed you in the trainings. Then you want to wash the area with soapy and warm water. Or actually, I don't remember. I'm not going to say warm water because I actually don't remember if you need warm water. I think it's just soapy water, and then you do a cold compress. And a cold compress just means you want something cold to apply a little bit of pressure on the area. So that could be like a bag of ice or an ice pack. And then in some cases, you might need an antihistamine. And remember, an antihistamine is just allergic medicine or allergy medicine. And there's so many different types of allergy medicine. There's Zyrtec, there's Allegra, there's Benadryl, and there's others that I can't remember the name of. And then, of course, if it's severe, call 911, right? If the patient or the victim who got stung is starting to have a really hard time breathing, or they're swelling up, and they're having a hard time, then you want to call 911, right? Okay, so let's say you have someone who gets stung by a bee. What if you get bit by a snake? Then what steps do we take? Well, we call 911 first. And then you want to make sure you find an AED and a first aid kit if available. So if available, get first aid kit and AED. And then third, you want to make sure that you remove any jewelry or tight clothes. Around the affected area. So if someone were to get bit maybe on their hand and they had a bracelet, you want to remove the bracelet because sometimes the area that's bit, actually most of the time I would say, it swells up. And so the swelling can then cause things to become tighter, and then it's really hard to remove after. Cuts the circulation. It can cause a lot of issues. So you just want to make sure you remove anything around there. But also when you're doing that, you want to make sure that you're not moving the affected area too much. So you want to avoid movement of affected area. And then last but not least, you want to make sure that you don't do anything crazy like suck out the venom or tie a tourniquet. I always spell this wrong. It's actually Tour and turn. Oh, there's an I here, guys. I'm sorry. A tourniquet. There we go. A lot of movies will show people like doing this, right? Sucking out the venom and then like tying a tourniquet. But this can actually be bad because if you just stop the blood flow, it will concentrate all of the poison or venom in one area, and that could actually be worse. And then if you're sucking out the venom, now you have the venom in you, and that's obviously also not good. Okay, so let's move forward with this. What is the most common cause of food poisoning? So actually, I'm not sure you guys have covered this yet, but we're gonna talk about it now anyway. When there is food poisoning, usually it happens because the food you ate was contaminated. So eating contaminated food. And when I say contaminated food, I'm talking about anything that's basically dirty or infected with bacteria or parasites. And so this will usually lead into symptoms like nausea, vomiting, diarrhea, abdominal pain, fevers, chills, sweats. If anyone has ever had food poisoning, you know what I'm talking about. And of course, lots of cramping. Okay, so let's move on to a moderate food allergy. So food poisoning and food allergies are not the same thing, right? And you will actually notice because the symptoms will be very different. If you have someone who has a food allergy, you tend to have symptoms like itching around, or an itchy or runny nose, I should say first, runny nose. Then you can also have itchy mouth, tongue, or eyes. Sometimes you'll have people who are not just itchy or runny or have a runny nose, they're also sneezing a lot. Sometimes they'll have like a few hives. Hives are just like raised bumps on your skin, right? Ronchas is what we call them in Spanish. So a few hives, maybe a little bit of nausea, not always. And maybe you're like a little uncomfortable, right? Mild discomfort. Maybe you're just like, oh, there's something going on. And when you have mild hives or a few hives, maybe that can also cause like a little bit of swelling. Running out of space. All right, so how do we treat a mild or moderate food allergy? Well, usually people will just take an antihistamine, nothing crazy. Like you don't really need an EpiPen, right? Because it's something mild. So you can just take an antihistamine. And then again, remember, antihistamine is just allergy medicine. If you have seasonal allergies, right, like you have a runny nose, an itchy nose, or itchy skin, especially when it's like summertime or spring and there's a lot of pollen out in the air, you usually will take an antihistamine. And again, these are like Zyrtec, Allegra, I should capitalize that, Benadryl. There's a lot out there. I just can't remember their names. And then you just want to, give them an antihistamine and Watch them closely. Make sure it doesn't get worse. Okay, good. Okay, last but not least, let's talk about what happens when you have a severe allergy. When you have an actual, like, really bad allergy, right? Typically, this is a little bit more intense. Your symptoms are a little more pronounced and people look visibly uncomfortable. So one of the things, or the thing that the type of response we have is called anaphylaxis. Anaphylaxis. And so we refer to this as anaphylactic shock or anaphylaxis. And this response is when you have a constriction. Constriction is another word for tightening. I can't spell today. Tightening of your airway. And so basically you have a really hard time breathing. And on top of that constriction, you also have swelling in the throat. You have your blood pressure, which can plummet. So it basically goes down. You can have some dizziness. And you can even feel lightheaded or lose consciousness. So LOC, remember, means loss. So having a severe food allergy is very different than moderate, right? The symptoms are very, very different and way more intense, right? Like losing consciousness does not compare to having some mild itching or some mild hives. So again, you can usually tell the difference. And the biggest part here that you don't notice here is like that tightening or constriction in the airway where people are having a hard time breathing. So how do we deal with anaphylaxis? Usually, typically, people who have like a severe allergy to food, like, nuts and eggs, shellfish, things like that, usually people know. And so when they know, they carry their EpiPen. And typically, I think you're supposed to carry at least 2 in case of an emergency, because you never know what could happen, right? Maybe something is mislabeled or someone doesn't know you have an allergy, you forget to ask, and you start to have a shock, anaphylaxis shock. So what you do is, first things first, since this is severe and can lead to, loss of consciousness, you always want to call 911 first. And if there's someone around, get them to get an AED, because again, you never know what can happen. And while they're at it, if they know, like the person that is having this shock knows where their EpiPen is, have them also get their EpiPen. So you call 911, you get the AED, the EpiPen, you locate it, where is it, right? And again, usually people know exactly where it is. It's usually in their bag or in their pocket or something. And then you administer the EpiPen. Now remember, administer. Sometimes the person will actually just ask for your help getting the EpiPen, and they'll usually administer it themselves. But there are times where they will need your help. And so when you administer that EpiPen, remember, blue to the sky, orange to the thigh. So the blue needs to be facing upward and the orange needs to be facing towards the thigh. Now, it's very important that when you're doing this, you keep the patient calm, or the person. You don't want them panicking because they're already having a hard time breathing. They're already stressed. So you want to keep them calm, and you want to wait for help to get there. And then also make sure you're not trying to give them like water or food, because this can actually be worse. Again, remember, their airway is closed and they're already having a hard time breathing. So you don't want to make it worse by feeding or giving water. And then just, be aware, because CPR might be required. your training states, and they explain that sometimes if you give the first EpiPen shot, the patient might not necessarily start to feel better right away. And so if they're not feeling better after a couple minutes, you might need to administer a second one if available. So just keep that in mind. And then in other instances where the EpiPens don't work, or there isn't one, it is very possible for someone to lose consciousness and require CPR, because again, that anaphylaxis reaction causes their airway to close and their blood pressure to drop. So not good. All right, so when you are done taking your notes, what you are going to do is you are going to flip your paper around and you're going to cut out all of the cutouts that are handed to you or that are on the desk. And you're going to place them on the back of your notes like this. This is just an example of how to cut them and how to place them. Remember that you guys are actually filling in the information, so don't forget to write in the notes. Poison control number would go back here, and then same thing with food poisoning symptoms. Make sure you put them here. And then this one, you know, you cut separately. Here are the little flaps. And yeah. So make sure you guys hold on to your notes. Remember, I will not be collecting them until the day of your quiz, which is next week. So don't turn any of these in. Just make sure you are finishing them and staying on task.